All right. So, as Steve said, I am Amanda Caudill. I work for Kentucky DAIL, Department of Aging and Independent Living. Um, I've been here as a health program administrator for almost 3 years. Prior to that, I was a physical therapist assistant that worked with geriatrics in a variety of settings. Today, we'll talk about giving some updates regarding what's going on at the state level with different activities and events, and also in the community level with our AAAs, our area agencies on aging. And then within the AAAs, we'll discuss what's happening for older adults with them and fall prevention strategies. So at DAIL, there are a lot of things going on. Some of the bigger things, we've been awarded a $1.75 million grant by U.S. Aging. Led by U.S. Aging, the Aging and Disability Vaccination Collaborative has distributed funding to Kentucky's Department for Aging and Independent Living to perform vaccination promotion activities. These activities may include hosting community vaccination clinics, providing in-home vaccinations, providing vouchers for transportation to vaccination sites, and outreach and education to older adults and people with disabilities regarding vaccinations. The proposal includes a Vaccine Vote initiative, along with hosting a vaccine clinic on Senior Day during the Kentucky State Fair. We'll also be partnering with the National Foundation to End Senior Hunger, or NFESH, with their senior-centered community college to provide vaccination education within the senior centers, as well as Western Kentucky University's Center for Applied Science in Health and Aging to integrate vaccination education into our 3D program, Bingo Size, into their platform. Vaccination clinics and health fairs will include the availability of COVID vaccinations, as well as influenza, pneumonia, and/or shingles vaccinations. The next topic would be our nutrition replication grant. DAIL applied for and received a grant for nutrition replication. What we'll be replicating is a suicide prevention program that was first established by Georgia State University. What we're going to do is train home delivery meal staff and volunteers in the suicide prevention program called QPR, or Question, Persuade, Refer, to recognize any warning signs of suicidal behaviors and/or mental health crisis in the home delivered meal clients. If they notice any behaviors, then referrals will be made to case managers or other staff that are trained in the evidence-based program called ASSIST, or Applied Suicide Intervention Skills Training. Then from there, they'll have further evaluation and intervention. We'll also be partnering with the Department for Behavioral Health and NFESH again during this grant cycle to develop dissemination resources, continuing education videos that's going to be available through the senior-centered community college, and training in both QPR and ASSIST. And excitingly, in September, we'll be having an aging and SHIP conference. Currently, it is set for September 27th and 28th in Lexington. Some of the topics that guest speakers will be discussing include home modifications, guardianship, disaster preparedness, Medicare, safety, caregivers, PACE, and much more. This conference is targeted for aging professionals, such as those that work at area agencies on aging and senior centers. We're very excited to be bringing this learning and networking opportunity to our communities, and we look forward to seeing everyone there. We know it's going to be a really good success. And then lastly, our Hunger Summit is currently being planned for November. So be on the lookout for save the date for that and more information regarding the Hunger Summit coming soon. Next, we'll move on to communities and the AAA. So the biggest focus in recent months has been on disaster recovery. We've had just terrible, terrible disasters on both ends of the state. The tornadoes in Western Kentucky and the flooding in Eastern Kentucky. As far as the AAAs, it stopped all services initially. The primary focus in the beginning were not only emergency resources to clients, but also meals. A lot of support was received from donations and volunteers to provide those meals. And then once things began to settle down, drive-through meals were utilized at local areas, and food trucks and available grocery store delis, they provided meals that met the nutrition requirements because they still had to meet those. And since the food trucks and all of that, most of the services have since been restored and restarted now. In Eastern Kentucky, one county had still not started services back a few months ago, but last month they should have restarted all of their services and be back up 100% again. So with fall prevention, most of the senior centers statewide offer at least one evidence-based health promotion and disease prevention program. These programs are offered mostly in person with some virtual options available. It's been hard to deliver virtually because just of our infrastructure, it's not set up for that. And it's just been a barrier to get that in there. Some places have the option, but mostly it's been in person. One effort that has been a large focus has been identifying seniors that are at risk of social isolation and offering programs and support. Addressing the needs of homebound seniors has been another task of focus, with programs being selected to meet the needs of these homebound seniors. A sampling of the 3D health promotion and disease prevention programs that we offer include Walk with Ease, both self-led program and a group-led program, Bingo Size, Tai Chi for arthritis, and one that is called CDSMP, or Chronic Disease Self-Management Program. Those are just some of the ones that we offer. There are others that are offered as well. Other efforts to reach seniors have involved having guest speakers and providing educational material related to exercises, home safety tips, etc. And seniors are assessed annually, in which any need that they have for safety equipment like grab bars or shower chairs is identified, and then the AAA will work to obtain those items for the seniors. One of our regions, 5CO, which covers, let me think. It's in the semi-northeastern section, if you're unfamiliar with it. Their region has recently purchased and implemented a new program called OBI. And I think I'm pronouncing that correctly. OBI is an interactive game console that projects custom-made games onto any surface, including tables, floors, and walls. So according to their website, OBI empowers moving, improves social interaction, and stimulates cognitive activity. The console encourages active play by utilizing touching, moving, and hand-eye coordination skills. So far, 5CO is showing great interest in OBI from the seniors, and they hope that this interest continues to grow to help improve the lives that they are serving. And there is a link on screen to the OBI video if anyone wants to jot that down. It's a little bit longer than I would like to play here, so I'm not going to play it, but it just goes into the OBI program, and sorry for my cat meowing, but it goes into the OBI program and shows you a little bit more of what it does, and they talk about how well it has been received for people that have implemented it. I think it's a wonderful fall prevention program to challenge balance and that hand-eye coordination, and then it also works on their cognitive skills as well. So, right. Well, that's the end. So I've left some time for questions and answers if anybody has anything that they have any questions on that I could possibly answer.
Could you go back to the last slide? I was trying to type in the link real quick.
Yeah.
Z. And hopefully I've got that right. So I put it in the chat box.
Okay.
And we do have a question. What did CDSMP stand for? The question was from Jenny.
It stands for Chronic Disease Self-Management Program.
Okay.
It's a really good program. It's more information based for the seniors. They learn to take control of their chronic diseases, and manage those with their doctors and with their medical team, but also the things that they are able to do on their own. It teaches them that it's there's exercises involved. It teaches them some of those. It talks about food, your relationship with food. Reading food labels was a really important part of it. It has them develop action plans each week, and the action plans that it has them develop are set at the beginning to be something that they can accomplish and not set them up for failure. So I think it's a really good program for that. And the seniors that have gone through it seem to have really enjoyed it.
Okay, Lloyd has asked, is there an opportunity for health departments to partner with you on vaccine promotions?
I'm sure that there is. That would be a better question for Susan Taylor, who's over that. And I can put her email address in the chat.
Okay.
Susan Taylor. That is Susan's email address, and she would be the perfect person to answer that one. I'm sure there is, because we at DAIL, we love partnerships. That it only furthers everybody's goals. So I want to
Okay,
see.
Carrie wrote in that the OB interactive playground tool looks interesting, and thanks for sharing. But then we had a problem, looks like, from Jenny. She said the video on YouTube says no longer available.
They might have changed one. Let me see. The link, I'll type in the link for their website. That is the website, and it will take you and show, they'll have different videos and stuff on there too. I think, if I'm not mistaken, when it first pulls up, it starts automatically playing a video on the website. My internet is going slow, so it's not taking me there so that I can disprove what I just said. But that is the website.
Oh, okay. So we have the website. If you go to the chat, she has placed the website in there as well. So, also, if you want to ask a question, you should be able to unmute yourself. If you can't, please let me know and I'll unmute you. So if you have a question you'd like to ask in person, well, please feel free.
You may have to do www in front of obforseniors.com, because I finally got it to pull up by doing that.
Okay. Okay.
And if there's anything that if you're like me, you'll get out of this today and be like, oh man, I just thought of something. My email is on screen. You can email me, and if I don't know, I'll find out who does know and I'll send you their way. But if I know, then I'll answer that for you as well.
Okay. Any other questions? Feel free to either put them in the chat or the question and answer, or to ask to be unmuted. We'd be happy to unmute you. We do have a little time here, so I think what we'll do is, if no one has any real objections, is go through and let people, and I'll name off people. If you just briefly introduce yourself, it's an opportunity at a summit to kind of get to know each other and who's online and who's attending the summit. If you have the opportunity and don't mind, oh, wait a minute, we've got a question. If a safety need is identified, grab bars, how are those provided?
The AAAs, once they evaluate them, there are different funding sources that they're able to get those items through. Usually, I think that would fall under not necessarily home modification, but that's probably what it would be called. And that would be one of the funding sources that they have through the Older Americans Act. And it helps provide that.
Any other questions? Because we're not trying to rush the questions, because I think that's an important part of this, is to have those questions.